Hello everyone, my name is Myrian and welcome to my channel. In today's video, I'm going to let you all know how I got into sonography or ultrasound, tips on how you can too, what program I went through, tips on how to pass your registry. So if you're seeing me for the first time and if you are not subscribed to my channel, I do work in the radiology field. I've been in this field for close to 11 years, and I do specialize in different modalities in radiology. So, if you also want to know about other radiology modalities and how you can get into it, I can make separate videos about that. Just leave the question in the comments. So, I do work in x ray, I work in CT, MRI, mammography, and breast ultrasound. So, I have my license to work in all these different modalities, meaning I took a registry board exam for all of these. I know some people can work in this, but when you work in these different modalities without having your license, then you won't get compensated properly for it. So if you're in x-ray and you are working in CT, working in MRI, it's better to just study and take your test, because if you are working in these departments, you're not getting compensated as in CT or MRI tech because you don't have your license. So how I got into breast ultrasound or sonography was whenever I got my x-ray and CT, I wanted to learn MRI. So whenever I did learn MRI, I was doing breast MRI scans. So a lot of patients would come into the MRI department for a breast MRI exam, and sometimes they would come in and they would tell me that they had a clip in their breast. So with MRI, if you don't know about MRI is like a big magnet. So whenever you go into the room, you have to make sure patients do not have any metal, or you can't have metal either. So you or the patient or anyone who has to enter the MRI room cannot have any metal, cannot have your phone, can't have your car keys, wallet, anything that's metal or has a battery cannot go in there, because number one, the magnet will destroy it. So it will not work anymore, or it will not work properly. Number two, it can burn you. So if you are someone who is getting an MRI scan and you have, let's say, some type of phone or some type of metal object or even clothing material on this metallic fibers, it can burn you. It can heat up. That's how the MRI machine works. So if you want to know more about MRI, just want me to do like a story time about it or another video about it, I will. But that's one reason why I got into ultrasound, was because a lot of patients, especially women patients, so a lot of women patients was coming in for a breast MRI scan. And it is for several reasons. It could be due to a personal history of breast cancer. So now they have to do follow-up MRI scans of their breast just to make sure it hasn't came back. It could be because a patient was just diagnosed with breast cancer, or it could be because they have implants in their breast and maybe they are having implant problems. Maybe they have dense breast tissue and it's just correlating with their mammogram and MRI scan, to make sure that they are not at high risk for breast cancer, or make sure nothing is hiding. And it also can be for patients who have high risk for breast cancer, whether they have family history of breast cancer, they have a genetic test that just came back positive for breast cancer. So, and another thing, I'm sorry if you hear noise in the background, I have a little puppy. And then another thing, patients would have just had like a mammogram or a breast ultrasound, and they had maybe a biopsy and a clip was placed in their breast. Being in MRI, working in MRI, nothing metal can go in the room. And if it is something metal, it has to be made out of titanium, or it can heat up or burn the patient. So when the patient was telling me that they had a clip in their breast, I was like, let me do some research to make sure that this is even safe. And working in ultrasound, whenever the radiologists do the biopsies, they tell the patient, hey, if you're getting like an MRI scan or if you're going to the airport, you don't have to tell anyone about the clip because it's not going to go off. It's not made of anything metal. It's like titanium. So patients will still tell me or tell another MRI tech, hey, they put this clip in my breast. I'm not sure if it's safe or not. So I would research titanium clip and breast. And the more I had to research to make sure that this was okay, the more I started developing an interest for mammography or mammograms. So whenever I developed that interest, I started a mammography program. And I did that program online as well. So if you want to know more about how I got into mammography, I can do a separate video about that as well. So because so many patients was coming in for a breast MRI, I didn't know anything about the clip. I researched more information about mammograms and breasts, and it led me to pursue mammography. So as I'm working in mammography, this is probably 1 or 2 years after I'm working in mammography. I worked at a facility or I worked at a hospital where there wasn't a lot of breast ultrasound techs. So in mammography, in that department, whenever a patient come in for like a mammogram or breast ultrasound or something happened on their, let's say, on their mammogram, their screening mammogram, if something was found, then the patient come back for a diagnostic mammogram and or a diagnostic breast ultrasound. Where I was working at, there wasn't anyone registered in breast ultrasound. They were just registered in mammography. There were a couple of techs who knew how to do breast ultrasound, but they still wasn't registered. So the radiologist trained them, and I was just looking at how the machine worked, and I was like so interested in ultrasound, and I never thought I was going to get into ultrasound because ultrasound has a lot of physics in it. So if you're looking at the image on the screen for the first time, especially, you're going to be like, what is this I'm looking at? I don't understand it. And it may discourage you from wanting to get into ultrasound. So the same thing happened to me. Even when I was a student in x-ray, I thought the ultrasound machine and how everything works was cool. But the state I came from, it wasn't a lot of people talking about ultrasound programs, and it wasn't a lot of people talking about how you can get into it. So I got kind of like, I pushed that back and then started to pursue CT because this was easier to get into CT, and a lot of people was doing CT scans. Like a lot of people need all of us in the radiology department, but more students or techs was like going for CT. So whenever I was shadowing this girl and I was seeing her do breast ultrasound scans, I was like, oh, I want to do that. And it was like, well, the radiologist trained me. Just talk to the manager and see if we can train you. So I think I spoke with the radiologist first. It was a lady radiologist I trained, very sweet, very helpful, had a lot of patience. And I'll talk about that in a second. So I spoke with the radiologist because she was a breast radiologist for breast ultrasound. I spoke with the radiologist and I was like, hey, I like to learn. I love school. I like ultrasound. Is it a way that I can learn breast ultrasound? Do you have time to train me? The other person told me that you trained her. And she was like, sure, I don't mind training you. And I said, I will talk to the manager because I know like a program I can go through and I can just use this site for my clinical. And she was like, okay, yeah, talk to the manager and let me know what she say because I don't mind training you. So I spoke with the manager and the manager was like, sure, you could train. When are you going to start? So I had already been looking into like ultrasound schools because I knew there was something that I was interested in. So before I even asked them if I could train, I wanted to make sure that there was going to be a school that I can go to for the classroom portion, and then I can use them as a clinical site. So that's exactly what I did. I went online and I got all of my ultrasound training done, or the educational part done strictly online. I did not have to step foot in the college, and I will let you know why. I never had to step foot in the college. I did all my training online, which I love online school because it's more convenient, especially if you're working, if you have a family, if you have kids. It's just for me, it's just convenient and better for me to study online because I feel like I'm studying on my own anyway when I was in a classroom because sometimes you're given PowerPoints, you're given notes, and you have to study or go home and study and review anyway. So I feel like I've always been teaching myself anyway. So I found this program online, and how I did was, and the program was very short. Like, actually, it really wasn't a program. It was like self study, and you can do this program. Well, I did this through ARRT. If you're just going through a regular ultrasound school for abdomen and babies and heart scans, then I'm not sure if you will be able to do it if you do not already have your ART license. So because I had my X-ray license and my mammography license through ART. So CT and MRI, we're not even counting that because number one through ART, they wanted you to have your X-ray license, number one, and then number two, to get the post-primary certificate, which would be breast ultrasound. I had to have like x-ray, and then I had a mammography license. So they gave me like a boost because I already knew the anatomy, I already knew the terminology, part of the physics for breast ultrasound because of mammography. So I went online and I went to this website. You have to go to a website if you're going to do it this way, where you're doing the educational part by yourself. Then you have to find a website online that will give you a certain amount of CEUs. Because for my organization, which is ART, I needed 16 hours of continuing education credits in order to even satisfy to set for the registry. So I went on their website and I started reviewing the material for 16 hours of continuing education credits. And I went to that website and I found the bundle. I don't know if the bundle was for exactly 16 hours of CEUs or if it was for like 20, 30 or 40, but find a website will give you at least that 16 hours of bundle so that you can study all this information, hand the certificate or scan the certificate over to ART, and then you'll be able to sit for the registry. So altogether, I think it took me probably 4 or 5 months to actually study for the actual for the actual educational part because I was also enrolled into a bachelor's degree for my bachelor's degree in radiology sciences. So I was enrolled into that. So I was doing both of them at the same time. So that's why it took a little bit longer for me to study and take my registry. I think I took and passed my registry in like 8 months. I studied and did my clinical or did my numbers all within 8 months. So it took me a long time to get the numbers in, and this is just strictly for breast ultrasound. It took me a long time to get the numbers in because I worked at a facility who did not do a lot of breast ultrasound. So I'm sure that's part of the reason why they didn't have a designated breast ultrasound tech and why the radiologist was doing mainly all of the scans was because they only had like one other person. So if she was off, the radiologist was probably doing the scans, or if she wasn't there anymore, then the radiologist had to take over with the scans. So that's why it took me a long time. And then another reason, which probably is the main reason, was that I'm PRN and I was PRN at the time. So if you don't know what PRN is, you're just working as needed whenever someone needs off, whenever someone is on vacation, or whenever someone calls in sick. So I was just PRN. So on the days that I was there, it wasn't a lot of breast ultrasounds being done. It was like probably three or maybe even five. They get ordered, but if a patient diagnostic mammogram come back okay, then that order get canceled and they don't have to have the breast ultrasound anymore, which is good because nothing is wrong with their breast. But that's why it took me a long time to get the numbers in. So tips on how I successfully studied through ultrasound school or my program and how I got my numbers in was that I found a book. So the website I went through, they had like a handout of in a PDF file. So that was like convenient because I didn't have to carry around a book with me all the time at work. If I was at work and I had downtime, I was able to study, or I was able to study on my lunch break or before I came in. So I reviewed their notes, and then I just kept going over the physics because on your registry, there is going to be a lot of physics, and you can find all this information on ART website. Like, it's no secret. They tell you what to expect on the exam. So it was a lot of physics on the test, like a lot of physics. So even if you're going for like abdomen, fetal, any type of cardiology ultrasound, general ultrasound, make sure you know your physics, because that is like, sorry, Cyrus in the background. Make sure you know your physics because that's like the bulk of the test, physics and anatomy. So I started studying that, and for some reason this my job wanted me, because my job cross-trained me, the radiologist cross-trained me. So all I had to pay was for the actual educational course, which was probably $400. And for some reason my job wanted me to have the certificate for the course before I got trained. And I was telling them, well, I talked to ART and the organization, and they don't care if you're doing your education and your clinical at the same time. Because if you're in a regular ultrasound program, which normally take 2 years depending on what you're going for, you're doing education and clinicals at the same time. So I don't know why my job wouldn't let me get the numbers in. So that's another reason why it took me a long time, because it's taken me about 2, maybe 3 months to actually study and pass all the certificates and courses and tests for this certificate that I'm doing, and then they'll let me do the clinical part. So I kept reading that book that I had. I had a physics book, which is like the main go-to book. You just look online, ultrasound review book or ultrasound book, and it will give you a list of books. Find the best book that has the most reviews. That's what I did, the most reviews and the most ratings and stars. So I kept studying that book for breast ultrasound, and then I kept reviewing the anatomy that was in the book. I didn't have a designated anatomy book. It was all within the book. And then I knew majority of the breast anatomy and terminology from mammo. So it's not the same thing. It's like totally different. But when you're looking at a mammo image, you kind of get like an idea of where you're at on breast ultrasound. And then you also have to label, you have to annotate your pictures, you have to put which breast you're scanning. So say for instance, I'm scanning the right breast. Scan your right breast, put what breast clock position you're at, 12 o'clock. How many centimeters from the nipple? 3 centimeters, 4 centimeters. If you're scanning transverse or if you're scanning sagittal, you have to label that out on the breast ultrasound image, because when you're looking at the breast anatomy, it all look the same. So you have to annotate your image so that the radiologist or someone who coming behind you can know which part of the breast you were looking at. So for the longest, whenever I was getting my numbers, so I had to get about 200 exams in, and then I also had to do or observe biopsy procedures, because in ultrasound you have to do biopsies with the radiologist, meaning you have to help assist them work the machine while they have their sterile gloves on, and then you have to set up the tray. So I had to observe or help with that. And then I was able to like satisfy all my numbers. So the radiologist trained me. She trained me throughout the whole time. And then there was times where I would go in and shadow the other lady who knew breast ultrasound, who was scanning but just didn't have her license for it. That's why I say if you're learning all these different modalities, make sure you take your test so that you can get compensated for it, because you're doing all this work, but you're not getting compensated extra for having these extra credentials. So after that, after I had got all my numbers in, I studied for my registry probably a month or two after that, because I was doing my bachelor's program at the same time. So I could have knocked it all out quickly, but I'm doing my bachelor's. So altogether, I will say do not study no more than 3 months. If you go past 3 months, you're going to forget stuff. I had about 2 or 3 books that I was studying from. I had my main book, and then I had two registry review books, and then I had a set of flashcards that I was studying from. So, tips I can give you is make sure you know your physics, make sure you know your anatomy, because that is like the majority of the test. So, make sure that you know that. Also, when you schedule your test, do not change the date because you're going to increase your anxiety. So do not forget the date. The date. Do not reschedule your date. When you're taking your test, read the question and answer, and then select your answer. Do not change it. So, was the registry hard? I will say the registry was it was just a little bit challenging because of the physics and because that I was taking my bachelor's degree at the same time. So if you know your physics, then you're good. Know your anatomy, then you're gonna pass. So the cutoff score for my registry was 75. That's why it's good to just go ahead and take the test, get the certifications and certificates knocked out because they are going to keep increasing that cut score. And then you also have questions on your test that they throw in that may not be counted. So you don't know what you're really getting asked. Well, you know what you're getting asked, but you don't know which question is going to count as the one that they're going to keep or throw out. So that's why it's just good to know all of this. And so do I like working in ultrasound? I do like working in ultrasound. I will say if you're not comfortable with working in it and if you don't work in it routinely or a lot, then you're not going to feel confident in yourself and you're not going to work in it. So whenever you get in ultrasound, just make sure that you're keeping your repetitions up, meaning keep doing the scans. At first, whenever I was studying and doing my clinicals, I was like, wow, 200 repetitions or 200 patients or 200 exams I have to get to sign off on. This is a lot, but it actually helps you. It helps you to become more comfortable and confident because when I was doing about 10 to 15 scans, training with the radiologist, I still didn't feel confident. I was like, I don't know what I'm looking at. I don't know how to get to this point. But the more that you scan, the more you do it, you get confident. So that's what happened to me. Right now, I'm not full time in ultrasound. I'm just PRN in ultrasound. I'm PRN in all of the departments I work in. So I work as a multi-modality technologist, meaning I may do MRI on one day, CT one week, X-ray this day, all in the same week, different weeks, mammo and ultrasound the same day because they all mammo and ultrasound is always going to be at the same facility or hospital because if a patient need a breast ultrasound after their mammogram, then it's all in the same facility. So I do like it. I will say the radiologist trained me standing up because it wasn't a lot of breast ultrasound, so it wasn't a need to sit down. And then they didn't have a chair for you to sit down anyway. So I would say scan sitting down, especially if you work at a place where it's a lot of patients coming in for breast ultrasound or ultrasound in general, especially if it take a long time, because it may take about 15 to 30 minutes to do the scan. I would suggest scan sitting down because it will save your knees, it will save your back, especially if you're sitting down. Watch your posture so you want to sit straight up, and then your arm is going to be lower than your shoulder. So you don't want to scan like this. You're going to like hurt your shoulder and your arm. You want to scan with your arm lower than your shoulder. You can also rest your forearm on the patient abdomen. That's how I normally do. Like don't press hard on it, but just rest your arm on the patient's abdomen. I wish I would have learn or train sitting down because for the longest I was scanning standing up. And if you have patients coming back to back, that's going to take a toll on your body, your knees, and your back. So just learn how to scan sitting down. Well, learn how to scan what's comfortable for you because for the longest, standing up was comfortable for me. And then I was training with another girl at a different place I went to on a different machine and she was scanning sitting down and I was like, "Ooh, I'm going to have to try that because it's a lot of patients coming in here. I'm used to scanning probably 3 patients, so I'm able to stand while scanning. But other than that, that's all I can think about. If you have any other questions for me, feel free to leave it in the comment section. Um, and I can make another video about it or I can answer your questions. But other than that, that's it for this video. Let me know if you have any questions. Feel free to give the video a thumbs up if you found it helpful and if you enjoyed it. And also let me know if you're going to pursue ultrasound school, if you're going to, which one are you going to do? Are you going to do breast ultrasound? Are you going to do abdomen? Do you want to study babies, hearts, carotids? Which type of ultrasound program are you looking for? Because mine was convenient and it was online, but it's all about what you want to do. Feel free to subscribe if you want to stay updated on my new videos, my latest videos. But other than that, thank you all for watching, and I will see you all the next time.